Andrew. And today it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Ganpat Sawant, who is present here with us and he will be answering some of our questions regarding today's topic, which is family planning. So, doctor, before jumping to the questions directly, please tell our viewers something about yourself.
Hello everyone, I am myself Dr. Ganpat Sawant, a senior obstetrician and a gynecologist practicing in Ghatkopar. I was also a medical teacher in the Padma Shri Dr. D.Y. Patil Medical College, Nellore, where I have trained n number of undergraduate and postgraduate students. So at present, I am working in Ghatkopar Noble Plus Hospital.
Thank you, doctor. And, doctor, which moment would you say was the moment when you decided to become a doctor?
Well, that was there in my mind from the beginning because I was fascinated by seeing those white coats and patients coming to the doctor, and then tremendous respect for these white coat and doctors. So that's the time I decided I want to be doctor and serve the community, serve the society, and that's how it brought me to this noble profession.
Well, doctor, that was a really great response. And so, moving on to questions now, as the topic itself says family planning. So, doctor, what is family planning?
Well, family planning is such an important issue, and today, because of family planning, in fact, couple can enjoy their the full life. So, in short, a family planning means the couple, irrespective of whether they are married, unmarried, or whatever it may be, they can decide when they want to have a child or how much spacing should be there between the two kids. And that's how they will have control on their own body, and they do not have to depend upon someone else to plan their family. And that's why it is really, really important family planning in today's era.
Yes, doctor. And, doctor, what is reproductive health?
Well, reproductive health means we have mental health, we have social health. Like that, reproductive health is health of your reproductive system, reproductive organs, and anything related to reproduction. So it's equally important for male as well as females. But for female, I'll say it's so important because she is the one who is going to carry child for 9 months and take care of the child. That's breastfeeding after delivery. So reproductive health means she's taking care of her reproduction by giving equal spacing of the children. At the same time, to become confident, yes, she'll be able to deliver and take care of a newborn. That's basically reproductive health.
And, doctor, why is family planning so important?
Well, family planning, I think it should be top of the priority for every individual. Why I'm saying so? Because if there's an unwanted guest in the family, say for example, unwanted child, then look at the child's condition as well as parents' condition. Why I'm saying so? Because today in a busy life we want to have one or two kids. If there are three or four, then the whole thing gets disturbed. Income, who is going to look after the kid, spacing between the kids, and we will not be able to give that much love and affection to the all the individuals equally. And that's why I feel this is really essential. We should be able to give 100% to our kid or children, and that's how a limited number is the best number.
Yes, doctor. And, doctor, what is the purpose of family planning?
Purpose of the family planning means I personally feel we should educate the whole mass. Say something like this: whatever we are doing the today's project, the common patients will be aware of what is this family planning. People will start discussing openly in the public about the family planning without feeling shy about it, so that more and more number of methods will be available, which we'll discuss soon, and they will be easily available on the counter. And that's why this family planning should be in the utmost importance at every level.
Yes, doctor. And, doctor, what are the benefits of family planning?
I think I have said earlier, but I'll repeat for the benefit of everyone. One, we can decide when you are going to have the first child, when you are mentally, physically, socially, financially stabilized. One. Two, basically have adequate spacing between the kids. That's two. Third is sometimes even though some of the kids they get married early, but completion of education is also equally important. So after completion of education, and lastly basically once mentally they are ready, yes, now me and my husband or me and my wife are willing to have a child, then that's the basically best time to have a child.
And doctor, what is an unmet need for family planning?
Okay, now what is the unmet need means basically if we have such a large population and if we consider India at the time of independence and today it's a population explosion means whatever the population was there at 1947, the same amount, that's another India is added to the country, and the resources are the same. Land is same, water is same, air is same, everything is same. So it's an unmet need. We are not able to do justice to this population explosion, and that's why we should be on our top priorities nowadays to control the population, and it should be a biggest need for everyone, individual, society, and policymakers.
Yes, doctor. And doctor, what are the effects of the unmet need for modern contraceptives methods?
Well, modern contraceptive methods, still I feel the older methods are not very well accepted by the society. But to remove misconceptions or myths from the society, now we are coming out with the newer and newer methods by which those misunderstandings will be removed from someone's mind, and new or more safer methods, more durable, more what do you say, more efficacious methods will be available in the society by which more acceptance will be there in the society, and I think that will have a big impact on the society itself.
Thank you, doctor. And doctor, what are the modern family planning available in India?
Well, say I'll put it other way around. What are the different methods of family planning available in India? Because for someone modern could be the remote for someone else. So if you want me to enlist everything, let's start from the basics. First of all, in olden India, it used to be say, prolonged breastfeeding was supposed to be the family planning, which was natural. Nowadays, girls they do not feed a child more than 4 months, 6 months. Initially, they used to feed for 2 years, so it was a natural contraception. Then comes the condoms, which are barrier methods, and those methods could be for female as well as male. Though female barrier contraceptives like a female condom, they are new. Then we have oral contraceptive pills, and there are so many changes in the oral contraceptive pills. And the latest ones, they are really safe, they are marvelous, highest efficacy rate. Then we have something called as intrauterine contraceptive devices, or government calls it as IUCD or COPT. Friends, remember, people now they want only one child. COPT, government supply is for 10 years. Other, what is the long acting contraception? This is a COPT for 10 years. Such a wonderful method. Then some of the places we have injectables, that is implants. And then if you want permanent method, then either tubectomy or nasbandi operation for both male as well as females. So this is a big basket of different methods which is available, and we call it as cafeteria choice. Cafeteria choice means like in a hotel you go and you say what do you want to have, they give a menu. Here this is the menu which is in front of you. You decide what you want to have from this. So this is the best cafeteria choice. Please discuss with your family doctor or a gynecologist and selecting Select the best what suits you.
And doctor, do family planning method also protect against HIV?
Well, I think this is a very wonderful question you have asked, and along with family planning, some of the methods government projected for prevention of STIs, that is sexually transmitted infections. And if you remember, few decades ago, HIV was rampant in India, and more number of male condoms and the female condoms were distributed for prevention of STIs. So, these methods of family planning, especially barrier methods, they not only protect from family planning, but they also protect from sexually transmitted infections. In fact, in some of the areas or highly susceptible individuals, we suggest use barrier method of contraception.
Thank you, doctor. And doctor, do some family planning methods have some side effects?
Well, which drug or which substance doesn't have a side effect? When you take something, any tablet, if you take, there's bound to be some side effect, but our duty is to take under supervision. Or anything, if you notice which is not good to your health, approach your consultant or a doctor. I think that's the best way. But in nutshell, I can say there is no serious side effects. With previous generation oral contraceptive pills, we had some methods or some problems which can be very well managed or not seen with the latest ones. But yes, word of caution is don't consume yourself all this hormonal contraceptive. Take it under doctor's supervision to avoid serious complications. That will be my suggestion. And take advice from the expert. Don't take advice from the layman or neighbors or the friends. For a proper thing, proper advice, you will not be harmed at all. That's my suggestion.
Alright, so it's time for a short break now. We will all see you in next few minutes. Welcome back to Anarika Talk Show again, and moving on to our questions. And doctor, does family planning have some infertility?
I think that's the biggest myth which is there in the society. Just tell me, if I put something in my ear and if I remove, the moment I remove, it's back to normal. So whether it's an intrauterine device, that's a property, or anything which I am using, if I remove, the next day my body is fit to become pregnant again. Only thing is some of the changes which takes in the body because of prolonged exposure to the tablets might take some time. Say for example a few weeks or a few months, but will never cause infertility or it will never happen because of this contraceptive method. She is not able to conceive again. That's the biggest myth which we have to bust it off.
Yes, doctor. And doctor, do men really play a role in family planning?
That question itself is very absurd. Male also equally play a 50% role, I'll say, or in fact more than that. Whatever you might say, India still has some dominance of the male. So if male are convinced about these methods of family planning, and that's why I said they play a little more role than the females. If he is very well educated, if he is very well aware, then in fact he will convince his wife or a partner to follow method of family planning. And it's not the question of whether male are responsible. They are more than female. They are in fact responsible, and they should take keen interest in the family planning of the family.
Yes, doctor. And doctor, what is the best method for contraception?
This is like asking for what is the best clothes which you like. Every individual have a different liking for different things, and that's why some time ago I mentioned it's a cafeteria choice. And like a shopkeeper, I will suggest them, look, for you this looks better, for you this looks better. But to answer your question, if somebody has had delivered a child, then I can suggest intrauterine contraceptive device because it's almost for 10 years. They are available in the market for 5 years, 3 years. So it's been inserted, and then she can lead a normal life the next day itself. If she has not had child, then oral contraceptives can be given. If somebody is prone or had a history of infections in the abdomen or uterus, I may not ask for intrauterine contraceptive device. If she wants temporary, then I might advise something like a barrier method of contraception. So it is their individual choice, but we can help couple to make the choice.
And doctor, what is vasectomy and how can it help in family planning?
Vasectomy is the permanent method of stopping the reproduction for the males, and the vas is the tube which connects for carrying the sperms. So vasectomy means we cut or ligate or staple those vas. It, believe me friends, it does not affect potency of the male, which is the biggest myth in the male uh, gender, and that's why this is not going to hamper your performance or a potency, but it's one of the best method as compared to a female sterilization, because female sterilization is done inside the abdomen of the female. Vasectomy is done outside. It's much safe, and there are least complications of this surgery, and that's why vasectomy should be promoted, accepted, and made available to all males.
Yes, doctor. And doctor, what are emergency contraceptive pills and how can they help in family planning?
Well, I think that's the hot topic in this society nowadays. Emergency contraception means when there is a exposure or there is a sexual contact without using any contraception, but the couple is not interested in having a child. So this becomes an emergency, or we used to call this as morning after pill. So these are the tablets which are commercially available, should be preferably taken within 72 hours. Earlier the better. And that's what called as emergency contraception. But the only disadvantage is some of the couples this practice emergency as a routine. Meaning every day they will have emergency, which is not the correct way of taking or using this high dose tablets, and that's why it's meant only for emergencies and not for routine use.
Doctor. And doctor, where can women find ECPs?
Well, I think you are talking about emergency contraceptive pills. ECPs are available everywhere, and you must have seen once upon a time there are big hoardings, then there are uh, back of the bus stations or bus depots. Everywhere it was written as unwanted pill and eye pill and so many things. So they are routinely available on the counter, all the medical stores. Plus, we are there. We will give you these medicines. We will write properly, and at the same time we will advise how to take it and what bad effects, if at all there, what are supposed to be watched for, but they are routinely freely available.
Yes, doctor. And doctor, what are the side effects of ECPs, that is, emergency contraceptive pills?
Well, emergency contraceptive pills are nothing but it's a high dose which is given in over a short period of time. So commonest side effect which is seen are nausea, vomiting, sometimes heavy hair. But that's very temporary and that's why nothing to worry. If it is a persistent or if it's a troublesome, then yes, you need to contact your doctor. And that's why I said you have to be under supervision. But yes, don't get scared, they are very safe and you can take it without any problem.
And doctor, what are male and female condoms and how can they help in family planning?
Well, I think everyone is aware about the male condoms and they are available in the medical shops and government is supplying free of cost. There's so many types of male condoms have come in the market. Initially they were latex, then we have thin, then we have ultra thin, then we have colored one, they have scented one, and they have different textures, then the ribbed one, and so many things are there. Why government or manufacturers are coming out with this? So that it should be accepted by the couple easily. That's the main thing. So it is used by the male. So male need to have control. It used to be used at the time of act, and that's why it should be readily available at that time. And that's why this is supposed to be good. I'll say this is still better than everyone else or any other method because of prevention of sexually transmitted infections. Coming to the female condoms, what happens for male condom? She has to depend upon the male to wear the condom, and it used to be worn only at the time of act. Female condom is something very good method because she can wear it in advance, keep it in place before the act starts. Plus, it covers the surrounding area of the female parts, so the chances she getting infection, she herself getting infection from the male partner are very very less. Only disadvantage is not freely available in India and it's a little bit costlier. But otherwise, it's a big boon for the female, and she herself is in her own control and does not depend upon the behavior of the male. That's how it's very good.
Yes, doctor. And doctor, what is IUD and how does it help in family planning?
Well, partly I have explained about the IUD, that is intrauterine device, or also called as intrauterine contraceptive device. It is to be kept inside the uterus. It's a one-time act. It is to be put by the expert, that is the gynecologist or a trained doctor. And in villages, I think there are trained nurses also there. So it is to be put inside the uterus. Next day onwards, she's, I mean, as good as the previous day. And as I told you earlier, it can be for 3 years, it can be for 5 years, it can be for 10 years, and that's why it is called as long acting reversible contraception. If suppose couple has a one child and they want to have only one child in their throughout the life, but at the same time they do not want permanent method of vasectomy or a tubectomy, then for them this is the best choice. In case if they change their mind and they want to have kid, removal takes hardly a few minutes. Just catch the thread and remove it. Of course, you can't do that, but doctor have to do it. But for you, that's for patient. They can check herself whether threads are felt or not. If threads are felt, that means device is very much safe in place. And that's how it's one of the best methods for married and those who have one kid. I think this is the best method available at the present.
Well, doctor, that was really a great response. And it means really a lot to us to be with you in Marika Talk Show. And thanks a lot for your precious time. So we will all see you in another next session with another exciting topic. Till then, to all the lovely viewers, stay safe, stay happy, stay healthy.